organism. So to kind of combat against drug resistance through the form of beta-lactamases, drug companies have started producing special drugs that use a beta-lactam antibiotic with also a beta-lactamase inhibitor. So this will block the enzyme and allow the beta-lactam antibiotic to be successful in terms of targeting the bacteria that reflects this type of resistance. And what happens here is, you can see through this, the use of these porin channels, this is how the antibiotic passes through. The antibiotic is not able to enter into the periplasmic space, and when the antibiotic attempts to target the penicillin binding proteins and starts to pass through the lipid bilayer, these beta-lactamases are there to kind of prevent that process from taking effect. So when this channel is blocked, the antibiotic can't pass through. However, in this particular channel here, the antibiotic is able to pass through, and once it passes through, the beta-lactamase will target the antibiotic. So when this is used with a beta-lactam antibiotic and a beta-lactamase inhibitor, what happens is the inhibitor can pass through first, and then that can cause the beta-lactamase to be inhibited, allowing the antibiotic to go in and still be able to use its beta-lactam structure because the beta-lactamase has been blocked up. So that's how that mechanism works. Some strategies in the war against drug resistance. Education is a big key, making sure that people are aware of drug resistance and knowing that it is a real thing. Getting patients to stop demanding antibiotics every time they or their children are sick, because we oftentimes want a magic bullet to kill everything. So we take these drugs and these chemicals and we put them in our body. But sometimes allowing, the body to heal itself might be better than, simply relying and having a high dependency on antibiotics. Physicians should not be pressured by patients who should prescribe drugs only when warranted. Clinicians should prescribe a narrow spectrum drug if lab results indicate that it kills the pathogen, because narrow spectrum antibiotics will target specific organisms, whereas broad spectrum are going to knock out a lot more organisms, and that can lead to higher risk of drug resistance developing. So those are just some strategies. Some other ones are that you should have patients destroy any excess or outdated medications, so that way they're not being used and bacteria can't encounter them in any way, shape, or form and live to survive and pass on resistant genes. Antibiotics shouldn't be used as prophylactic. They should be taken only when infection has been ensued. Good control mechanisms need to be employed by healthcare professionals, and the patient should make sure that they complete their course of treatment regime in the manner that was prescribed by the doctor. Because resistance is developed when we don't completely kill off all of the bacteria that we were trying to fight. Undesirable effects of antimicrobial agents. We've talked about some of these already. Pretty much, you can start selecting for resistant organisms, so obviously we don't want the development of drug resistance happening because the resistant organisms start to survive. You can have potential side effects such as allergic reaction or toxicity to human tissues. And then you don't want to have necessarily prolonged use or dependency on an antibiotic, because this can disrupt, again, the normal flora in the body, and that could, again, lead to you becoming susceptible to more highly pathogenic bacteria. Okay? All right, so this is kind of the conclusion of our controlling microorganisms in vivo. unit. So I hope you learned a lot. So remember, there's all kinds of different types of antibiotic treatments out there, or antimicrobial treatments that are used. And as always, make sure you contact me if you have any questions about anything. All right, thank you guys and have a good day.